Room 787, Jerry Cunningham. He came in 3 days ago due to multiple injuries sustained in a head-on motor vehicle accident, including a broken clavicle and femur, extreme internal bleeding, as well as a traumatic brain injury and lower spinal cord injury. I've checked his chart. He has no documented advance directives in place at this time.
Is he married? Does he have any family members involved in making decisions for him?
He is divorced, but his 2 daughters have been here and they are responsible for deciding whether or not to continue his treatment as is or discontinue care. The idea of reading his last rites has been brought up since he is Catholic, but his daughters are not in agreement of whether or not they want to go through with this at this time. This has caused some tension, so be aware of that when you go and talk to the family.
Okay, yeah, thank you. What are his vital trends?
The patient is comatose and on a ventilator and has been showing consistently low blood pressures with bounding pulses.
Okay, thanks. I'll talk with the daughters about the benefits of palliative care and see if I can get them to come to some type of agreement.
Great.
Good morning, Mr. Cunningham. I'm Michaela and I'll be your nurse today. Hi, I'm Michaela. I'll be your father's nurse today. What are your names?
I'm Mary.
Hi, Mary.
I'm Elena.
Hi, Elena.
We're his daughters.
Oh, okay, awesome. Well, how are you guys doing?
How do you think we're doing?
Oh, stop being so dramatic. You always make things worse. We're doing fine considering our circumstances.
Well, you're so calm and don't seem to care about him at all.
I know that this must be a difficult time for you, and if you have any questions, I'm here to help you. I'm going to perform an assessment on your father now and administer medications. I'm going to check his name tag. And we're going to check. Okay, Mr. Cunningham, I'm going to do your vitals now. You're going to feel a squeeze. Beep. Alrighty, Mr. Cunningham, now I'm going to assess your skin and your legs. Now I'm going to listen to your heart. Mr. Cunningham, I'm going to go prepare your medications. I have a painkiller for you here, Mr. Cunningham. I'm going to check your wristband for your date of birth and your name to match my documents.
You know he can't hear you, right? Why were you still talking to him while you were assessing him?
I was talking to him because even though he is unconscious, It's a courtesy to the patient to just continue to let them know what's going on and to let them know that we're here and we're here for them, especially as we're moving around on their body so that way they can be comfortable.
Okay.
So what were his vitals? Is he okay?
Your father's pulse is high, but his blood pressure is decreasing. His O2 saturation is 90% and his temperature is within the normal range. Oftentimes, this is an indicator that a patient is going into shock. Shock is commonly seen in patients who go through traumatic events such as motor vehicle accidents, like your father.
But there's still a chance that he could live and be okay, right?
Your father has been through a lot of stress and his body isn't reacting the way that we had hoped it would, especially after such a traumatic accident. I understand that it is hard to think about, but I would encourage you to think about what he would want in this situation. We can keep him on treatment and keep him comfortable, but that would keep him alive and comfortable. The machine is breathing for him, and the likelihood of him coming off the machine safely and without any complications is very low. Your other option is to continue with palliative care and transfer to hospice, which will ensure your father is as comfortable and pain-free as possible. This doesn't mean that he will get better or rapidly decline. It just focuses on quality of life. You look upset. Is there anything that you'd like to discuss?
I feel like everyone has given up on Dad. I know that he has a lot of bad injuries and it doesn't look good, but Dad's a fighter. I know he would want us to keep him alive and give him a chance to pull through at least. My sister just doesn't seem to care and is perfectly fine giving up on him. He's done so much for us and I just can't give up on him when it gets tough.
It sounds like you're frustrated with your sister about the lack of concern about your father. How do you feel, Mary?
You know, he would never want to be kept alive in this state. He can't do anything. He doesn't even know that we're here. I do care about him. I'm just trying to do what I think Dad would really want for himself in this situation. And he would want to be put out of his misery and wouldn't want to suffer any longer.
Now that you both have expressed your feelings about the situation, I think it would be a good time for you to talk to one another about what your father would really want. This is a time to consider your options that we talked about earlier, and also since I saw that he was a Catholic, maybe start talking about his last rites.
Oh yes, that'd be great. If we could get a priest in here to talk about last rites, that'd be good.
Oh, okay, I will go and call him.
I know the nurse mentioned that we should talk about last rites, but I really just don't think it's time. He isn't going to die. He's going to pull through and be fine. We don't need to talk about it.
You do realize Dad is 86 years old and the prognosis is not looking good.
I know it might not look good, but with palliative care, he could get better. They will make sure he is comfortable and pain-free, and maybe with time and relieving all the stress from the procedures and all the machines, he will improve and get back to his normal self.
Well, we can still do last rites. Just doing last rites doesn't mean he's gonna die.
I know, but that's just what it seems like right now.
Father Erica, I have some sisters in room 787 that would really like to talk to you about the last rites for their father. Will you come with me so we can talk to them?
Of course, I'll come right with you.
Thank you. Hi, Mary.
Hi.
This is Father Erica.
Hi.
And he's here to
Hello.
talk with you and your sister about last rites.
The nurse had mentioned that you have some questions for me regarding your father's last rites and condition.
Yes, thank you for coming. We do have a couple questions.
I don't have any questions. I don't think it's time to do last rites because there is a chance that he will be fine.
So it seems as though you understand that last rites are only for the dying. Is that correct?
Well, yeah, it is called the last rites, so I would assume it would be his last rites before he dies.
Well, last rites are also called anointing of the sick and are given to anybody who wishes to receive them when they are sick. Having any kind of procedure or in the last moments of life, performing last rites is not meant to be a death sentence. Rather, it offers absolution and can be received in an unlimited amount of time in a person's life.
So if he receives them now, he can receive them when he's actually dying?
Yes, there is no harm in performing last rites at this time.
Doesn't it make sense now?
It does make a lot more sense.
Okay, so I think we should go ahead and go forward with last rites.
I agree.
Okay, I'm gonna put on some music and we will perform the last rites.
Thank you, Father,
Peace be with you.
and with you.
Thank you.
I know I haven't been very open to even talking about what to do. I've just been really overwhelmed, but I do think after the last rites that it will be best if we continue with palliative care and give Dad the best quality of life that we can.
Yeah, it's hard because we have to take ourselves out of it and just think about what he would want best for himself, and I think palliative care would be the best.
Okay, so we made a decision?
Yes.
Okay.
Hi, Mr. Cunningham. It's Michaela, your nurse again, and I'm just back to talk with your daughters. Hi, ladies. I saw that the priest came into your room. Did you guys reach an agreement?
Yes, I think after the last rites, we've talked things through, and I think we have finally decided what we want to do. We've decided on palliative care and hospice.
The palliative care and hospice will be good as this extensive treatment will be discontinued and he won't have to suffer through the painful procedures that he has had. It'll also ensure that he's comfortable and pain-free.
You're right. So I'm glad that you guys have reached a decision. I will contact the social worker and let her know that what your guys' decision has been.
Okay, thank you.